This is an audio-visual representation of a study published in the Journal of Bone and Joint Surgery in 2024. Reverse total shoulder arthroplasty, or rTSA, improves forward elevation, pain, and function in patients with rotator cuff tear arthropathy. However, its effect on humeral rotation, which governs basic activities of daily living and overall clinical outcomes in rTSA, is less predictable. Further, orthopedic practitioners have been debating the ideal humeral component version for optimizing humeral rotation and clinical outcomes in patients undergoing rTSA. In a prospective randomized clinical trial, researchers determined effects of the humeral component version on external and internal shoulder rotation 2 years after rTSA. They compared multiple clinical outcomes in 66 patients who had undergone rTSA, assessing differences between patients with the humeral component in neutral version and those with the humeral component in 30 degrees of retroversion. Notably, both groups achieved comparable clinical outcomes. Patients in the two groups showed similar improvements in shoulder abduction, forward elevation, internal and external rotation, and muscle strength. Additionally, they exhibited comparable improvements in patient-reported outcomes at the final follow-up and low complication rates. Although scapular notching occurred in 21.2% and 15.2% of patients in the neutral and 30-degree retroversion groups, respectively, this difference was not statistically significant. These findings suggest that placing the humeral component in neutral version or 30 degrees of retroversion results in similar clinical outcomes in patients after rTSA.